Good afternoon, everybody. Thank you for joining us here December 10th, 2020. It's your COVID update. My name is Matus, the Tribal Emergency Manager. With us today, we also have Dr. Renteria from the PYT Tribal Health Department. First off, I'd like to start off and read some statistics from the Tucson area. A reporting date of December 20th, 2020. Confirmed positive cases from all sources is 847. Confirmed deaths is 15. From the PYT Tribal Health Services Division, testing completed from March 23rd, 2020 to December 7th, 2020. Negative results have been 6,812. Positive results have been 451. Positives since last reporting date is 178 in a 2-week period. Recovered cases are 529. That's for Tucson area. Now the Guadalupe area, and this also comes from all sources up in the Guadalupe area. And this report date is December 9th, 2020. Confirmed positive cases is 978. And remember, the positive cases in Guadalupe are not only tribal members, but other Guadalupe community members. They don't have that separated out, so that's total for the town of Guadalupe. Confirmed deaths is 18. And from the PYT Tribal Health Services Division, testing completed from May 11th through December 5th, 2020. Positive results are 231. And we have no numbers for recovered cases. Thank you. Go ahead.
Buenas tardes, thank you for tuning in. What I want to do is just give you a little bit more detail on how serious this spike is. For this report that Andre just mentioned, in the last 2 weeks, we've had a very serious increase in positive cases. From November 24th to December 7th, and Thanksgiving was included in that time period, we've increased by 178 positive cases. And within those positive cases, we've had multiple community members who passed away. That's the highest we've had, the most serious we've had, and it's very significant, and there's no coincidence that Thanksgiving was in that time period. So again, I'm going to give you a little more detail, but it speaks to how we have to be really, really careful with our families and the people we're around, because that is very serious. And I feel really sad for the families that lost members during that time.
Okay. I'd also like to mention that PYT tribal government continues to operate on a reduced workforce. Many are operating by appointments, many of the departments, and we'll be putting out an updated directory for all pretty soon, so keep your eyes out for that with updated contact information for all of our departments. I'd also like to mention we still have COVID-19 testing available to the community in New Pascua. For the month of December, it's still at the Albert V. Garcia Auditorium, Monday through Friday. The times have changed, however, though. The time will be from 9 to 11:30 p.m. And then 11:30 they will stop for their lunch break, and then it will resume again 1 p.m. to 4:30 p.m. And please, again, visit the COVID-19 PYT-nsn.gov to pre-register and obtain your confirmation number for testing. Rapid tests are available from SIPMed. That's the company we use at the testing site. I would also like to recommend that those who are coming to test that are having symptoms of being sick. The health department recommends that you go to an urgent care or you contact your primary care physician. Please don't show up there sick. They don't want folks that are showing signs and symptoms that could possibly be COVID showing up at the testing site. Another date I'd like to remind you of is Saturday, December 12th. Testing will be in the community of Marana, at Yoem Pueblo, at the community center. and that's located at 11782 West Cebu in Marana. 85653 is the zip code. And they're going to be testing there from 10 a.m. till 2 p.m. That's all I have for testing. We'd also like to let you know that the deadline for the Pascuayaki CARES Welfare Assistance Program has been extended through December 28th. So please visit the COVID-19 Pascuayaki-nsn.gov website to apply. There's a very short window for application. So they need to process your application. So please don't hesitate. If there's any way you've been impacted by COVID and you need any type of assistance, you may fall into the categories that are applicable for this. So please don't hesitate to call and at least ask. There'll be somebody there that can help you. And that's all I have for that. Number 5.
If you're visiting any family member, especially an elder, whether they're in another home, not in yours, or if you're visiting some of our elders here at our senior center or on the senior apartments, you need to be very, very careful. They're some of the most at-risk folks, so if you're coming, you must definitely wear a mask. Don't come if you're not going to wear a mask, because remember, you need to protect them too. And ideally, you need to be washing your hands before you come also. So, with that in mind, what I'm going to do is just review again some real basics about how to protect yourself and others, okay? And before I do that, I just again want to just make a couple of comments reminding folks of how this virus spreads. So the virus spreads easily from person to person, okay, but between people who are in close contact with one another less than 6 feet. The respiratory droplets that are produced when an infected person coughs, sneezes, breathes, sings, or talks. So you may have no symptoms, but if you're talking, breathing, or just exhaling in a loud way, you can be spreading the virus. These droplets cause the infection when they're inhaled through your nose and your mouth. So that's why when you wear your mask, it must cover your nose and it must cover your mouth, not just your mouth or it looks like a little chin strap. So make sure it does that, because just cover your mouth, and if your nose is exposed, it's really not doing what it's supposed to do. You're still transmitting, or you could get infected if you breathe it in through your nose. So what should everyone do to protect yourself and others? As we mentioned before, wash your hands, and we've told you many times on how to do that. 20 seconds with soap and water is ideal. If you don't have soap and water, then use a hand sanitizer. Avoid close contact. Stay at least 6 feet, about 2 arm lengths from another person. As we just mentioned now, cover your mouth and nose with a mask when you're around others. Cover your coughs and your sneezes. Clean and disinfect frequently touched surfaces daily. This includes your computer tablet, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks. And monitor your health daily. Be alert for symptoms like fever, cough, or shortness of breath. Especially important if you're running essential errands, going to and from your house or your workplace, settings where it may be difficult to keep a physical distance away, like 6 feet at all times, like example, the grocery store. Take your temperature definitely if symptoms develop. Don't take your temperature within 30 minutes if you just were exercising or taking a medication that can lower your temperature, like Tylenol if you took it for a headache. So just reminding you what to look out for. But again, if you're visiting an elder, your grandmother, your grandfather, whether it's here on the reservation or somewhere else, definitely wash your hands before you go, wear that mask, and even when you're there with them, stay 6 feet away. Thank you.
Thank you, Dr. Renteria. Okay, next topic I'd like to talk about is the Pascuayaki Network installation of Wi-Fi. That has started this week, so please be on the lookout for any phone calls or messages that may be left at your doorway notifying you of installation. It's going to be really important, and it's going to help everybody receive and disseminate information that is really, really good for your household. One other reminder, pretty soon you'll see the new signs. reminding everybody as you drive into our community that the Bosque Yaqui tribe has enacted a coronavirus protection ordinance in response to the COVID-19 pandemic. And then it lists all the things that you need to do before you come into our community. So please remind your friends, co-workers, and other people that you still have to wear a cloth face or some type of face covering required in any public setting. Practice social distancing, wash your hands frequently. A stay home and order is in place. The curfew is still in effect from 9 p.m. till 5 a.m. And no large gathering events or parties. All this is subject to citation from law enforcement. So please remember, all these things have been implemented to keep you safe, to keep your co-workers safe, and to make our community a safe place to live and to work. So please understand, all this is done for everybody's safety. Okay, thank you. Next up.
Okay. I'm going to give you a little vaccine update because you've been hearing a lot about this in the news, and it's very possible that very soon you'll start hearing about actually people getting vaccine doses here in Tucson, including us. The tribe is going to be using the Moderna vaccine for the tribal community. We are working with the Indian Health Service to receive the vaccine. Right now, actually as we speak today, the Food and Drug Administration is reviewing the Pfizer vaccine. If they agree that it's safe enough today, the Pfizer vaccine could be shipped out within 2 days, but we're not going to be using that one. The Food and Drug Administration will be reviewing the Moderna vaccine on December 17th, which is roughly a week from now. Same rules apply. If they think it's safe enough on that date, then they will start shipping that within approximately 2 days. So we will probably receive our vaccine hopefully within 2 days of that time, if it's approved. Our vaccination plan follows the Center for Disease Control and Prevention guidelines. The guidelines describe phase 1 as the group to be vaccinated as emergency first responders, frontline health workers, the elderly in nursing homes, persons at high risk who are 65 years of age and older, and other essential workers even if they're not in the areas of health. The vaccine is not mandatory. You must agree to be vaccinated. We will be given a small amount to vaccinate only phase 1 personnel. Phase 2 includes the general population, but those doses will not be available till maybe March, April, or likely April. So the general vaccination for the community is not this phase 1, it's phase 2. And again, we've asked for a certain amount of doses to cover those first responders and the people outlined, but we don't really know how many doses we're going to get until we actually receive them. So that is all I have for you right now. As we have more information with Ms. Nunez and her team here, I'll be giving you more reports, and we may also do some stuff on the radio to keep you updated, because I know there's a lot of questions on this. Thank you.
Thank you, Dr. Renteria. I'd like to remind everybody once again about our mass messaging system. On your phone, if you would text PY Tribe to 888-777. Again, I'll say that one more time. Text PY Tribe to 888-777. And you'll receive a lot of this information and additional information about food box delivery, just anything that's pertinent and important that we feel the community needs to know. So, as Dr. Renteria said, even as the vaccine comes on board, it's still going to be very important for everybody to, remember the basics. Keep your social distancing, wear your mask at all times, and clean your hands and disinfect all areas as much as possible. So, again, we're here to help you. So please keep the community safe, keep yourself safe. And as Dr. Renteria said, we thank Mrs. Nunez and Mr. Angel Lopez for their behind the scenes work with this. We always appreciate their assistance. And that's the end of our report for now. Thank you. Bye-bye.